Let me start today with something honest, something most men over 60 rarely talk about, but absolutely should. Because if you're like many of my patients, you might be thinking, "Doc, I take my meds. I walk a bit. I eat better now. Isn't that enough?" Well, here's the truth. There's one part of your body that often gets left behind in all this so-called self-care. It's a part that's not only central to your identity as a man, but also a vital sign of your overall health. I'm talking about your penis. Now, I know just saying that word out loud at our age might feel awkward. But if you're still with me, you already understand that ignoring this conversation is not the answer. Because caring for your penis, especially after 60, isn't about vanity or performance. It's about health, it's about confidence, and it's about making sure you're not silently suffering in silence. So today, I want to walk you through the essential care every man should give his penis. Simple, practical steps that could not only improve your intimate life but actually protect your long-term well-being. But before we get into the specifics, let me tell you about a gentleman I once treated. His name was Harold. Harold was 71 when he came into my office. He wasn't there for anything specific, just a routine checkup. But when we talked about his urinary health and sexual function, he looked a little embarrassed. He leaned in and whispered, "Doc, I haven't really paid much attention to it for years. I figured it's just part of getting older, you know?" I nodded and smiled gently. "That's exactly why we're having this conversation, Harold. Because just like your heart, your lungs, your eyes, your penis needs care too." Over the next few visits, Harold learned a few simple techniques and habits that not only improved his hygiene and circulation but actually boosted his confidence in ways he hadn't felt in decades. So, who am I to tell you all this? My name is Dr. Robert Jansen, and I've been a practicing urologist for over 30 years. I specialize in men's health, especially the changes we face after 60. My goal has always been to give you straight answers, no fluff, no judgment. Just real solutions that work. And let me tell you something right now, you are not broken. You are not beyond repair. You are still a man, and you deserve to feel good, function well, and enjoy every part of your life. That includes your most private parts. Now, I'll be covering 5 essential care areas throughout this video series, but I want to begin this first part by focusing on the foundation, cleanliness and skin health. You'd be surprised how many men neglect this simple area. Especially if you're uncircumcised, proper cleaning under the foreskin is vital. Over time, dead skin cells, oils, and bacteria can build up under the foreskin, forming a white or grayish substance called smegma. Left unchecked, this can lead to irritation, odor, infections, and in some cases, even painful swelling. One of my patients, Jerry, 66, came in complaining of redness and itching. He thought it was an allergic reaction. Turns out, it was just poor hygiene. A gentle rinse under warm water, using no harsh soaps, every day during his shower made all the difference. Even if you are circumcised, don't assume you're in the clear. The penile skin is thin and sensitive. Using overly fragranced soaps or scrubbing aggressively can cause micro tears, drying, and irritation that you may not even notice at first, but your partner might. So here's what I recommend. Use warm water and a gentle, fragrance-free cleanser, preferably one designed for sensitive skin. Gently retract the foreskin if you have one, clean underneath, then dry thoroughly to prevent moisture buildup. After showering, pat dry, don't rub, and if your skin feels dry, apply a small amount of natural, unscented moisturizer. This small step alone can reduce your risk of infections, itching, and embarrassing odors, and it keeps the skin supple and healthy. Now, while we're on the topic of skin health, let's talk briefly about visual checks. Just like you'd check your scalp or your moles or your nails, you should do a quick scan of your penis every week or so. Look for discoloration, new bumps or lesions, persistent redness, peeling or scaling skin. If something feels or looks off, don't ignore it. Early detection of things like infections, cysts, or even penile cancer, rare, but real, can make all the difference. This is your body. You deserve to know it well. And speaking of knowing your body, can I ask a small favor? If this message is connecting with you so far, if you've ever felt unsure about how to properly care for your penis and want to learn more, please take a moment to click that like button, subscribe to the channel, and tap the bell icon so you never miss advice like this. Also, leave a comment below with a simple, "Yes, if this is a topic you feel men should hear more about. Or, no, if it still feels too private to discuss openly. Either way, I'd love to hear from you, and yes, I personally read your comments to tailor these videos to what really matters to you. Alright, let's circle back to Harold for a moment. After just a few months of following the hygiene and skincare routine we worked on, Harold came back and said something I'll never forget. "Doc," he smiled, "I didn't think such a small change would do anything. But I actually feel cleaner, fresher, more aware of my body again. Even my wife noticed something different. It's like I've reconnected with a part of myself I thought was long gone." That's the power of intentional care. And it doesn't take fancy tools or expensive products. It takes consistency, gentleness, and a willingness to treat yourself with dignity. In the next part, we'll be diving into the second essential area of penis care, circulation and blood flow, and how it directly impacts both your sexual health and urinary function. But for now, I want you to remember this: your body listens to how you treat it. Every moment of care, no matter how small, sends a message: you matter. You're still a man. You still deserve attention, health, and pleasure. And with the right habits, it's all within reach. This is Dr. Robert Jansen. I'll see you in part 2. Welcome back, friend. If you're here, that tells me something important. You're ready to go a little deeper, not just with your knowledge, but with your care for yourself. And I want you to know, that matters. In part 1, we talked about the importance of hygiene and skincare, keeping your penis clean, healthy, and free of irritation or infection. It may sound basic, but for many men, especially over 60, it's a piece of the puzzle that's often forgotten. Today, we're going to focus on something just as important, maybe even more essential as you age. And that's circulation and blood flow. Now, I want to be very clear about something. You are not losing your ability as a man because you're broken, or because you've done something wrong. What's happening is natural. Blood flow slows down with age. Arteries may stiffen. The vessels that used to carry blood effortlessly to your most private parts now face a bit more resistance. But that doesn't mean you're stuck. It means you need a smarter strategy. Let me tell you about a patient of mine, Roger. He was 68 when he first came to see me. A proud grandfather, recently retired. He told me, "Doc, everything's fine on paper. I walk, I eat okay, but when it comes to intimacy, well, things just don't seem to respond like they used to." What Roger didn't realize was that his circulation, particularly to the pelvic area, had gradually declined over time. And without good blood flow, even a healthy desire can struggle to translate into performance. So what did we do? We created a simple routine to boost pelvic circulation, and within 6 weeks, Roger was smiling again. Not because he was chasing youth, but because he felt like himself again. So let's break down what you need to know. Your penis is like a sponge. When it's healthy, blood flows in easily, fills the chambers, and keeps things firm. But if your blood vessels are stiff, inflamed, or clogged, that sponge never fills up. So the question becomes, how do we restore and support that flow? First, we need to talk about movement. I know, you've heard it before. Exercise is good for you. But this isn't about hitting the gym or lifting heavy weights. This is about simple, daily movement that gets your blood flowing where it matters. Start with 20 minutes of walking a day. Not speed walking, not jogging, just consistent movement. Think of it as pumping fresh blood into your engine. Then, consider pelvic floor exercises, also called Kegels. Yes, they're not just for women. These exercises strengthen the muscles around your base, the ones responsible for holding in urine, and yes, helping maintain erections. A few gentle contractions a day, holding for 5 seconds, then releasing, can dramatically improve your control, function, and confidence. If you're unsure how to do them, try this. Next time you're using the bathroom, pause your urine stream mid-flow. The muscles you use to do that? Those are your pelvic floor muscles. Practice tightening those muscles when you're not urinating, and you've got yourself a simple, powerful tool. Now, let's talk about nutrition. There are foods that help your circulation, and foods that silently hurt it. Good news first. Beetroot, spinach, arugula, pomegranate juice, walnuts, dark chocolate. All of these help boost nitric oxide, a molecule that relaxes your blood vessels and improves flow, down there. One man, Lawrence, age 73, told me he started adding beet juice to his lunch every day and felt a noticeable difference in nighttime firmness within a week. On the other hand, foods that clog arteries, processed meats, fried foods, sugar-laden snacks, these tighten your vessels and choke off your natural circulation. If your doctors warned you about cholesterol or blood pressure, this is even more urgent. Now I know making changes in our 60s and 70s isn't always easy. But here's the trick. Start small. One healthy swap at a time. Maybe trade your fries for a handful of walnuts. Replace your soda with pomegranate juice. Add one green to your dinner plate. These aren't punishments. They're investments in your manhood. Another factor that's often overlooked? Sleep. Yes, sleep. You produce the majority of your testosterone, your male hormone, while you're asleep. If your sleep is poor or inconsistent, your hormone levels take a hit, and with it, your ability to get and stay firm. So what can you do? Go to bed at the same time each night. Avoid screens at least 30 minutes before sleep. Keep your room cool and quiet. These small steps restore your body's natural repair system and give your testosterone a chance to do its job. I also want to gently mention medications. Some blood pressure medications, antidepressants, and even common allergy drugs can affect your performance. I'm not saying stop them. Never do that without talking to your doctor. But if you've noticed a dip in function after starting a new medication, bring it up at your next appointment. There may be an alternative that works better for you. Now, before we close this part, let me ask you something important. Has your circulation changed in the past few years? Do you feel colder in your hands or feet? Do you notice more numbness or slower recovery after activity? If so, you're not alone, and your body is simply asking for attention. That's why I'd love for you to do something right now. Drop a yes in the comments if you've ever worried about blood flow and how it's affecting your confidence. Or type no if it hasn't been a concern yet. Either way, your answers help me guide these conversations better, and they help other men feel less alone. And please, if this is speaking to you, take a moment to like this video, subscribe, and tap the bell so you don't miss what's coming next. Your support means the world, and it lets me keep making these for you. To wrap up, remember Roger? Just 6 weeks after focusing on circulation, walking daily, eating for blood flow, and doing simple Kegels, he came back in with a different energy. His wife came too, and she said, "Thank you, Dr. Jansen. He's not just more active, he's more alive." That's the gift of caring for your circulation. It's not just about performance. It's about feeling strong, vital, and connected again. In the next part, we'll talk about another essential, but often ignored, aspect of penis care: urinary health. Because how you pee tells you a lot about how healthy you really are. Until then, stay kind to yourself. Move a little, nourish your body, and remember, you're not too old, you're not past your prime. You are still powerful, more than you know. I'm Dr. Robert Jansen, and I'll see you in part 3. Welcome back, my friend. If you've stuck with me through parts 1 and 2, then you already know something many men your age are just starting to realize. That caring for your penis isn't just about intimacy, it's about your whole health. We've talked about hygiene, skin health, and blood flow. Today, we're going to tackle something that affects nearly every man over 60 at some point: urinary health. Now you might be thinking, "Doc, isn't peeing just peeing? I've been doing it my whole life." Yes, and no. Because what your body does in the bathroom can tell you a lot about what's happening with your prostate, your bladder, and even your nervous system. And if we ignore those signals, small problems can become big ones. Let me introduce you to someone, Ben. Ben's 74, a retired electrician, quiet guy. He came into my office because, as he put it, "I'm tired of living in the bathroom, Doc." He was waking up 3 to 4 times a night to urinate. During the day, he felt an urgency that would hit out of nowhere, and sometimes he didn't even make it to the toilet in time. He thought it was just aging. But what we discovered was an enlarged prostate, also called BPH, benign prostatic hyperplasia. It's not cancer, but it can squeeze your urethra, making it harder to empty your bladder fully. That leads to more frequent trips, weak stream, and that annoying sensation of, "I just went. Why do I still feel like I have to go?" And Ben wasn't alone. By the time men reach their 60s, more than half have symptoms of an enlarged prostate. And by 80, it's over 80%. So let's talk about what to look for. A slow, weak, or interrupted stream. Dribbling at the end of urination. Frequent urination, especially at night. Sudden urges that are hard to control. A feeling that your bladder isn't empty. Now, these symptoms don't always mean something serious, but they do deserve your attention. Because untreated, urinary issues can lead to bladder damage, infections, or even kidney strain. That's why one of the most powerful forms of penis care you can give yourself, especially at this age, is to pay attention to your pee. So what can you do? Let's start simple. Stay hydrated, but smartly. Many men think, if I'm peeing too much, I'll just drink less. But that's the wrong approach. When you don't drink enough water, your urine becomes concentrated, irritating the bladder and making those sudden urges worse. What I tell my patients is this: spread your water throughout the day. Don't drink large amounts all at once. And avoid too many fluids 2 hours before bedtime to cut down nighttime trips. Now let's talk diet. Some foods are known bladder irritants. For example, caffeine, alcohol, spicy food, acidic fruits like oranges and tomatoes, artificial sweeteners, and carbonated drinks. I had a patient, Sam, age 69, who cut out soda and cut back on coffee, and within 1 week, he was sleeping through the night without getting up to pee. Just like that. Instead, eat foods that support prostate and bladder health: pumpkin seeds, broccoli, berries, green tea, and omega-3s from fish. And here's something you may not have heard before. Pelvic floor exercises, the same Kegels we discussed in part 2, can also help control urinary flow. They strengthen the muscles that support your bladder and urethra, giving you better control and less urgency. Now, another important point. If you're straining to urinate or experiencing pain, don't ignore it. These can be signs of infection, inflammation, or a more serious issue like prostate cancer. Get checked. It's quick, it's painless, and it could save you from future trouble. Let's circle back to Ben for a moment. After a few tests, we confirmed his prostate was enlarged, but not dangerously so. We put him on a gentle medication to relax the prostate muscles. He made small changes to his routine, cutting back on caffeine, doing pelvic exercises, drinking water consistently throughout the day. Within a month, he was waking up once at night instead of 4 times. His wife told me he was more relaxed, less cranky, and finally feeling rested in the morning. That's what a little awareness can do. And let me be clear, it's not just about avoiding the bathroom at night. Chronic sleep interruption affects your memory, mood, blood pressure, and even your libido. So by protecting your urinary health, you're also protecting your overall vitality. Now I'd love to hear from you. Have you noticed any changes in your urinary habits lately? Do you feel like you're peeing more often than you used to? If so, let me know by typing "yes" in the comments. Or type "no" if things still feel normal for you. Either way, your feedback helps shape these videos, and it reminds other men they're not alone. And if you haven't already, please like this video, subscribe, and tap the bell icon so you don't miss the final part of this series, where we'll be talking about emotional and psychological care. Because your penis doesn't operate in isolation. Your mind, your mood, your confidence, they all play a role. Before we close, I want to remind you that taking care of your urinary system is not just about preventing embarrassment. It's about feeling in control of your body again. And there's no age limit on that feeling. This is Dr. Robert Jansen. Your health is still your power. And you deserve to feel that power every day. I'll see you in part 4. You've made it to the final part of this series, and I want to say something right off the bat. That shows strength. It shows commitment. And it shows that you, like so many other men in your 60s, 70s, and beyond, are ready to take care of every part of yourself. Not just what others see on the outside, but what truly matters inside. We've talked about hygiene, blood flow, and urinary health. But today, we're diving into an area that often gets swept under the rug, yet might be the most powerful of all: emotional and psychological care of your sexual health. Now, some men might be tempted to skip this part. Feelings? What's that got to do with my penis? They might chuckle. But let me ask you this. Have you ever felt disconnected from yourself or your partner, even when everything physically was working? Have you ever struggled with performance, not because of your body, but because of stress, shame, or self-doubt? That, my friend, is exactly why this matters. Let me tell you about Carl. Carl is 72, married to his high school sweetheart for over 50 years. When he came to see me, he was embarrassed. "Doc," he said, "my body's doing all right, but my head's not in the game. I feel pressure. I overthink. Sometimes I feel like less of a man than I used to be." And I've got to tell you, Carl's not alone. In fact, emotional struggles are one of the biggest reasons men over 60 report difficulty with intimacy, even if their health is otherwise stable. So let's talk about how to take care of this vital part of your manhood. First off, know this: your worth is not defined by performance. You are not just a body. You are a full human being, with feelings, desires, worries, and hopes. The more you recognize that, the easier it becomes to let go of the pressure and reconnect with yourself and your partner in a deeper, more meaningful way. A key area many older men struggle with is performance anxiety, that creeping fear of, what if it doesn't work this time? That fear becomes a cycle. You worry, your body reacts, and then it doesn't go as planned. Which makes you worry more. But here's the truth: your body responds best when it feels safe and relaxed. So the first step is to shift away from performance mode and toward connection mode. Take the pressure off the goal and bring your focus to the moment. A warm hand, a shared laugh, a kiss that lingers. These things are not secondary, they are everything. And if you're alone right now, whether divorced, widowed, or simply single, this still applies. Because intimacy with yourself matters just as much. So many men have internalized shame around solo intimacy. They think it's juvenile or dirty or somehow wrong after a certain age. But I'll tell you this as a doctor: regular, healthy self-touch helps keep your tissues responsive, maintains circulation, and supports your prostate. Just as important, it fosters body awareness and emotional connection. It's nothing to be ashamed of. It's an act of care. Now, let's talk briefly about communication. Whether you're in a long-term relationship or just starting one, open communication is vital. If things have changed for you, if your energy is lower, your erections aren't as firm, or your needs are different, it's okay to say that. In fact, your partner likely knows something's going on already. And most of the time, what they want isn't perfection. They want honesty. They want closeness. They want you, present, attentive, and open. I once had a couple, Tom and Ruth, both in their mid-70s, come in for a shared consultation. Tom had been avoiding intimacy, afraid of failing. Ruth finally said, "Tom, I don't need the old days. I just want to be with you. Hold me, kiss me, touch me without disappearing into your head." That moment was a breakthrough. Because when you take off the pressure, when you let go of the idea that your masculinity depends on one part of your body behaving perfectly, you give yourself, and your partner, the chance to reconnect in beautiful, real ways. So what does emotional penis care really look like? It looks like checking in with yourself regularly. Asking, how do I feel? Am I avoiding touch out of fear? Am I pressuring myself to be someone I no longer need to be? It looks like celebrating progress, not perfection. Like noticing when your body responds, even just a little. Like saying, I'm proud of myself for trying, for showing up. It might mean talking to a counselor, joining a men's group, or journaling your feelings. And yes, it might even mean watching a video like this and saying, I deserve this. I deserve to feel whole. If you've made it this far, I'd love to hear from you. Please drop a yes in the comments if today's message resonates. Or type, still learning, if this emotional side is something you're just now starting to explore. And don't forget to like, subscribe, and tap the bell icon so we can keep building this space together. A place where older men can talk about real issues, without shame or silence. Before we end, let's go back to Carl for a moment. After a few visits, some light medication to support his blood flow, and lots of talks with his wife, something shifted. He came back to me one day, a little smile on his face, and said, Doc, we danced in the kitchen last night. No expectations, just music. She leaned into me, and I felt like a man again. Not because of what happened next, but because I was finally present. That's the kind of health I want for you. Not just firmness in the body, but strength in your heart, connection in your soul, and peace in your mind. So here's your final reminder, from me to you. You are not alone, you are not broken, and you are never too old to love, to feel, and to heal. This is Dr. Robert Jansen, wishing you health, happiness, and wholeness. Take care of yourself, You deserve it.